The position of your implants is absolutely critical to having a successful result. Let's take a look at an implant design that we're doing right now. Here are two implants. Here are the crowns that will go on those two implants. And of course the implants and the teeth need to be lined up properly so that the patient is biting correctly on the upper teeth. If we don't do that, what's the reason for the dental implants? So if we take a look at this section right here, what you're looking at is a cross-section of one of those implants, where this is the cheek side of the bone, this is the tongue side of the bone. Notice where the implant has to be in order to line it up properly with the upper teeth. If I put the implant in here, it wouldn't be in the right position. And look at where the implant has to be. Here's the bone right here. It's absolutely critical that the implant have the correct depth as well as the correct dimension from outside to inside to be sure that things line up properly. There's only one way I can do that well, is number one, design this on the CT scan, and then make a surgical guide which will help me line up the implant in the correct position. So once we have the implant design on the software, we have our laboratory in California make this surgical guide. And you may be able to see this. There's a little sleeve right here. So that when I put my drill in, I'm drilling in the exact place where that implant is supposed to be sure that it lines up properly with the bone and where the future teeth are going to be. Surgical guides are absolutely critical in several cases, or in many cases, in order to be able to be sure that the implant lines up both with the teeth and the bone. And it's up to us to work together to make sure we have the best result possible.